issue is not marijuana. The issue is patients' rights. It's my right to use the best treatment my doctor can afford me. And if my doctor says marijuana is one of the drugs in the spectrum that is best treating your glaucoma, then I have that right to use marijuana. I have that right to use that drug, and it just so happens that that drug is marijuana.
What exactly is the condition that you've been diagnosed with?
It's called chronic open-angle glaucoma.
And you said that quite a few people in your family have this condition as well.
Yeah, it's a hereditary thing. All the males on my side of the family have glaucoma. Some of them are already legally blind and walk with a white cane and that, because that's where glaucoma finally ends at.
Total blindness?
Total blindness, yeah.
James, what exactly happened in the United States that brought you to Holland?
I was prosecuted by the federal government for misdemeanor, possession of marijuana.
Simple possession?
Simple possession, yes. And at the time of cultivating the marijuana, I was dealing with a doctor who was treating my glaucoma with marijuana. And I got busted and arrested.
They took everything.
They took everything, all my personal property.
40 acres?
90-acre farm. 90-acre farm, the house and everything. And I had to do a year in federal prison.
A year in maximum security federal prison for possession of marijuana.
A misdemeanor. And also because I did a lot of interviews, I got to go on what they call the Federal Prison Merry-Go-Round Express, where every month they send you, or every couple of weeks they send you to another prison.
And nobody can find you.
And it's difficult to do interviews because you're on your way to Oklahoma or Sault Ste. Paul, Dakota or something, and it's hard, for depressed people to make those interviews.
Exactly. It's hard to communicate, and that's what they're trying to do, it sounds like, is to prevent communication.
Yeah. In fact, I signed a statement after I had done my time in prison, had served my time. I still had to sign a statement to the federal government saying that I would keep a low profile, and I would not talk to anybody in the media. And that's the only way I could get out of prison. Otherwise, they said they were just going to keep me in prison.
So you had to.
I got a copy.
They tried to muzzle you to.
Amen. And I got a copy of that. And the only side effects I see from marijuana is the U.S. government, and the things that they put me through. I'm still having to pay on my mortgage on my dad's house for the legal things.
This is the house that was confiscated?
No, this is another house. This is my father's house. But to deal with all these legal fees, they were beyond me. They were over $100,000 at one point.
Right.
My father mortgaged his home, because he believed in it too, to throw some money in for the legal fees, and I'm still paying him back $25,000 I owe him yet. I'm paying on his house, and if I don't pay, they kick him out of his house, because the bank still has the mortgage. So I mean, those are the effects that have been worse on me than any marijuana.
Yeah.
That's stressed me more, or done more damage to my heart, or my lungs, or any part of my body, nervous central system or whatever, and going through the federal prison system and going through Marion, a maximum security, Alcatraz, the system presently, that did more to stress me out and damage me than marijuana's done in 20 years,
I can imagine.
And like I say, I've been smoking it since 1966. I smoke it every day. I smoke it at 5:30 in the morning before I go to work. I hold a responsible job, I was thought in America that you could be free, and if there was some plant in your garden that could help your health, you would be allowed to grow this. I thought that was freedom, what was freedom all about, So that's why I went and joined the service, because I was fighting for these principles, but I learned years later that the U.S. doesn't necessarily back these principles, and that's why I'm here in Holland, because they truly stand behind, freedom principles.
James, what is the big development the last few months here?
In October of 1993, The Hague approved the Stichting Institute of Medical Marijuana.
That's the Dutch government?
That's the Dutch government, yes. And the institute has the ability to hand out, or has the legal right to hand out marijuana to patients with a doctor's prescription. And also we have the legal right to develop and research varieties of marijuana for different diseases, because there's been studies that show that different herbs
or different varieties of marijuana affect different illnesses, and so we're encouraging studies in that.
James, what are some of the goals of the Institute?
We have many goals. First was to provide quality marijuana to patients at a reasonable price, and hopefully we hope to get the price even lower as the number of patients grow, because we're obtaining a greenhouse in which we'll grow the marijuana and sell it. We're a non-profit organization, so we sell it to the patient at cost. Mm-hmm. So we hope.
How does this price that you'll be selling at, how does that compare with, say, the common street price here?
It's probably 1/4 of the street price now, but we hope to get it down to 2 guilders a gram or so per patient. And so, because there again, a patient who is using marijuana as medicine shouldn't have to pay an inflated street price for medicine. And also, we're trying to help getting the Sicken Funds, which is the insurance company or health plan here in Holland, to pay for marijuana, because our prescriptions are legal, the doctor is legal, so therefore it's legal medicine, and it should be paid for by the Sicken Funds, just as any other medicine is. And so we're working on that with lawyers. We provide a lot of information, flyers like this in Dutch and English, where marijuana is medicine and some of the things. And like I say, the things we talked about, marijuana has been proven. Mm-hmm. We do a special one on glaucoma, and we're developing one on cancer. And so we provide information. We provide contact services. A patient can call us if he wants to talk to another glaucoma patient who uses marijuana, or just to somebody who smokes marijuana.
What about referral?
We have also, the Institute has a clinic who we refer you to a doctor, or you can have your own doctor write a prescription and we'll fulfill the prescription, or you can come to the clinic and have one of our doctors do it. There's several avenues to take to get a prescription filled.
Mm-hmm. You're probably the only really legal marijuana here, right?
Technically, yes. We sell marijuana legally with the Dutch government knowledge. We pay taxes. Everything is legal and white. We're registered with the Chamber of Commerce here. Like I say, the government overlooks our expenses and everything.
Of course, marijuana was already available here in the coffee shops, of course.
Yeah, right.
What are some of the other conditions that marijuana has been shown to be helpful for?
Marijuana has been shown helpful in migraine headaches, in cancer, chemotherapy, in glaucoma, in MS. It's been, a lot of studies have been done in AIDS lately, with helps the wasting away syndrome, and also the patients sleep at night, and also there's been some study with T cell count and the relationship with marijuana. So we're encouraged at the Institute about these studies. And there's also, marijuana is the best muscle relaxer short of morphine, so it's good for people with back pain, stress release. Really, the Institute, in our flyer, we list over 100 illnesses that marijuana has been recognized for in medical articles. So there's plenty of studies done, and like I say, if you have access to Medline, you can see that there's hundreds and hundreds of studies been done with marijuana as medicine, not only in the U.S. but throughout the entire world.
James, aren't there some patients whose glaucoma does not respond to the other types of treatment?
Yes, there's some patients like myself and who don't respond to conventional drug therapy. And some of these people, one of them is called, I have a form of glaucoma called low tension glaucoma, and Timoptic in that doesn't control it as well as marijuana. I have documented studies that show that marijuana lowers my eye pressure lower than any conventional drug does. So therefore, marijuana is the best medicine because it keeps my pressures at the lowest, which I have to.
And weren't you telling me about an English lady that was thinking about laser surgery, but had instead thought maybe marijuana might be safer?
Yeah, for for not all patients, but for some patients that were facing operations such as laser surgery where they burn a hole in your eye to drain the liquid, she used marijuana and she didn't have to have the surgery because it affected her outflow so good that her pressures went down.
Wasn't there a chance that she could have gone blind if she'd opted for surgery?
Yeah, well, that's a chance with any surgery, and especially optic nerve surgery, is just the slightest movement or error and you lose your sight in that eye.
Isn't marijuana legal as a prescription in quite a few places in America?
Yeah, in fact, 37 states in America, marijuana is legal as medicine, but because of the federal government and their regulations, it doesn't exist. It's, technically available, but the federal government is a supplier, so therefore...
And they don't supply it.
And they don't supply it, so therefore it's not available.